Hello, everyone. Come on into All Things Odd. I am Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
And I'm Whitney.
And we are here every Thursday at 12:30 p.m. Mountain Standard Time. And I'm going to have someone just kind of talk a little bit about our YouTube channel real quick before we dive in.
All right. Well, last time I checked, we had 71 subscribers. So we got a new subscriber this week. This is our YouTube channel. So if you just put our business name in the search, you can subscribe. And so that way you'll get a little notification when we have a new episode. If we're out of town or something, we skip an episode, but you can come back here and look for old ones. And I think last time it said we had like 98 videos or something. So we have a lot of videos that you could watch, 97. So you could really fill a whole afternoon with watching All Things Odd if you wanted, even though that sounds a little painful for me. But you can see what the episodes are about here, and you could send them to somebody who doesn't have social media if you want.
Yeah. Look at this. So our Tinnitus Awareness Week one, we got 49 views, which is kind of cool. 2 weeks ago. And then the next one that people liked was when we talked to the startup of Owsy, like where you can bling up your hearing aids. So it's kind of cool to see, how many people have watched different ones, which ones are popular, things like that. But as always, you can always send us a message and you can let us know if there's something that you want us to talk about today. So February, we've talked about it, but last week, February is, we talked about hearts and the connection between the heart and the ear. And this is the last Thursday of February. So we thought we'd still kind of focus a little bit on the heart since February is American Heart Month and we're trying to spread awareness. So to kick off basically our show today, I have a question that I'm going to pose. And if you are watching this on the replay too, then stick it in the comments, if you've got something to say. But the question is, do you feel that a modulated sound or something that sounds like a heartbeat is soothing? Because I know that a lot of the times, like on sound machines, or if you've had kids, babies, part of kind of like a machine that you could put in their room does have a heartbeat sound. And I mean, obviously it's because, when they're in the womb, that's what they hear. And so people think that it's quite soothing. So my question to Dr. Galloway and to Whitney as well is, do you feel that a modulated sound such as a heartbeat is soothing to you?
Yes.
It's not to me. I actually get like kind of freaked out if I'm like close enough to someone where I can hear their heartbeat. And I think it's just because I'm thinking of it as like very scientifically, like, okay, blood is going into all the chambers and I can hear that. And I don't know why that's just never been, even when I was little. I remember my mom would, put me on her chest and she would hold me. And if I could hear her heartbeat, I'd move my ear so that I couldn't hear it.
Funny.
So that's just like probably weird in me. I like other sounds for soothing, but yeah, the heartbeat one is not one that I love to hear. I hate to hear it if I'm like on a run and I can hear my breathing and my heartbeat. I'm like, oh my gosh, hate it.
I will say not my own necessarily heartbeat, but like on a sound machine. We had one of our dogs when we were crate training him. We got that sound machine that had the heartbeat sound because I read that for puppies, especially when they're separated from their mothers when they're really little, that's soothing. So we did that. And then of course I have kids and they each have a sound machine in their rooms, and my daughter's is like ocean waves. And it's like very relaxing, and even hearing it through the baby monitor is like relaxing. And it's probably just because I know she's asleep and the baby monitor is quiet other than these like, ocean wave sounds. But it's funny because not only is it soothing like in there, it's soothing through the baby monitor, just like the audio of it. So
That's funny. Yeah. I never thought, when I was young and I like had a toy stethoscope, I loved listening to my heartbeat because I thought it was cool, I don't have an aversion to that, but I don't care for modulated sounds at all. I think that especially because I work with people with tinnitus as well, like I kind of stay away from the modulated sounds. I feel like it's a little more distracting. But I just thought I'd pose that because we're talking about a topic today about hearing like your heartbeat in your ear. But we had talked in preparing for today's show, we had talked about some other things that we're going to get to. However, one of the things I was going to bring up that we're not going to talk about, but so we're going to start off and kick it off with this is some people feel like a little flutter in their ears, and for a couple of things. So I'll talk about two different things, and we'll have like Dr. Galloway and Whitney add to it as well. But typically when people come in and they say like, I feel like there's a flutter in my ear, and it's something that kind of comes and goes, and it lasts for maybe a few seconds or so, and it goes away. What we found out in our clinic and just practicing, both Dr. Galloway and I have seen that it is probably due to what we call a myoclonus, which is kind of like a twitch of the middle ear muscle. And it's kind of like if you think of an eye twitch, it's kind of like that. Like you have really no control over when it happens or when it doesn't. And it doesn't last for very long, but like you can still feel it. Like it's that sensation that you're feeling. And yes, it can be kind of irritating. I know that when I've worked with previous ear, nose, and throat physicians, they had recommended a muscle relaxer for that, which I think, obviously if it's happening a lot and it's kind of irritating, then I could totally see that. But if it kind of comes and goes, it's pretty random, I would say kind of let it go. The other thing I was going to talk about a flutter in the ears, if you ever been in, and we've talked about this on a previous show, long time ago, so I don't even think that show is up anymore, but have you ever been in a car where you kind of roll the window down on the side? Look, I did like the old school, like roll the window down with the crank. So that's, I don't know why I did that. But when you roll the window down, maybe on one side of the car and the other side isn't, and there's not a real way to equalize that pressure. Like, I don't know if you guys have ever felt that kind of pressure differentiation. And like my ear has fluttered, and I'm like yelling at whoever's in the car, like, somebody else roll their window down or roll that window up or whatever it is. And that's, again, something different. It's not from a myoclonus, but it's from the pressure differentiation from one side of your eardrum to the other side. So that's kind of a different thing of what we're going to talk about, but I thought I'd kind of bring that up real quickly and see if Dr. Galloway or Whitney has anything else to add to that.
Yeah, the fluttering in the ear, I think that it sounds like if you've ever felt your eye twitch and then you go look in the mirror and you can see your eye like twitching, it sounds like your eye twitch looks. So it's like you can hear exactly. It's like if you were trying to make a sound to that eye twitch, that's what it is in your ear. And I've had a patient say like, I think there's something in my ear, like a bug or, something, and a flutter. Of course, we've all seen those videos online of like this person had a giant cockroach in their ear. And so I think people have sometimes been worried that there's actually a bug in there or something. But it's just usually comes in, at least for me, it comes in a little cluster. And it's like, just like when your eye twitches and then it goes away and then no more of it. But I could see the muscle relaxer being helpful just to pinpoint, is this what this is? Or is this, something different? So I've definitely had people complain of that. And that's the best way I can describe it, how it feels is like, your eye seems like it's so obvious and like you'd think that everyone else can see it. And then you go to the mirror and you look and it's so tiny. It's just not a big deal at all. And probably someone having a conversation with you might not even notice. But to you, it feels like a really big thing.
Yeah.
Yes, that's exactly what I was going to add on to that.
All right. So the next question is that we're going to tackle today is like, we've got patients that come in and ask us this, but what does it mean when I hear a heartbeat in my ear? And so I'm going to have Whitney kind of talk a little bit more about this here.
Yeah, so one of the things that could mean is there could be a glomus tumor present. So I have a lot of information provided by Duke Health and Stanford Medicine, but a glomus jugular tumor or a paraganglioma, it's also called more commonly a glomus tumor, and that's the word I'm going to say because it's a little bit shorter. But they're rare neuroendocrine tumors that can involve different areas of the skull, base, and neck. They're named for the structure that they arise from. So carotid body tumors. So if you guys can see in that middle ear cavity, that's where that tumor is growing. And they usually involve some sort of vein. The most common type is the most common involving one is a large vein called the jugular bulb. And then it involves the middle ear, the glomus tympanicum, and finally the vagus nerve. So there you just have a lot of nerves and veins that run around in that area. And so when we get something pressing up against them or something that's growing on them, it can actually make you you're actually hearing that like blood and that pulsation. These can occur really at any age, usually more like 40s to 60s, and usually just in isolation. So usually just one. They can, in rare cases, you can have multiple of them. And they aren't typically malignant. So they're usually benign tumors as well. So not cancerous. And they usually don't spread. And they're also very slow growing. So you might have had one for a while before you do eventually start to notice. But without treatment, they can harm the surrounding tissue, damage those nerves that I previously mentioned, and cause other serious problems. So at some point, after it's found, a medical physician will likely want to intervene and probably remove that tumor. So, but that could be one reason why you are hearing your heartbeat in your ear.
Yeah, I like these pictures. I know that Dr. Galloway has to add to this because this top right one kind of shows the tumor itself here growing. And if you look at this right here, I think you guys can see my arrow right here.
Yep.
Okay, so this is the ear canal right here. And this little line, this white line is the eardrum. And so it kind of occurs behind it. And sometimes when you look in, and I like this picture because some people, this is over the lunch hour. So some people don't like to see kind of like inside the ear and like, like body things, right, while they're eating. So this black and white picture shows it really well, but this definitely shows that tumor behind the eardrum. And then this bottom left also shows when we look in, like this is what we're seeing into the eardrum. When we look into the ear, like we might see the eardrum itself, and you can kind of see some of the landmarks of the ossicles. But then we can actually see sometimes the tumor itself behind the eardrum when we're looking in. And if this was in color, typically what we've learned is that if there's kind of a reddish blue or purple tint to this, then and then also some of the symptoms that people are noticing, right, with the heartbeat in the ear, that it's typically a glomus tumor. So I like this picture here because it kind of shows you a little bit more and it's not as graphic.
Yes, the glomus tumor that I have seen in person, it was very much the patient's eardrum. They had complaints of heartbeat in the ear. And I asked them if it did follow their heartbeat, like they had, held their wrist and like checked their pulse. So it's like, yes, it's the same. And it was louder on one side of their head than the other. And the eardrum looked pretty purple. Like there was a dark blue mass behind it because of that, deoxygenated blood that's in there. And you could actually see the eardrum move with her heartbeat because of that tumor sitting back behind there. And this patient did not come in with concerns of hearing loss or anything like that. But just having it been my first experience with this kind of a pathology, it was a younger patient, and she did have some hearing loss after it was removed because it was sizable and, it does damage tissues around it. So that was interesting because in the pre and post-op audio, she had more hearing loss after it was gone, but it was just the nature of removing it and whatever else had been damaged in the process. So this kind of hits it home too, just how close all of that is in there together. So if you have that tumor, like from the top right picture that you're trying to remove, there's going to be kind of a void under there, and look at what was there before, so I see why it would have could have complications more serious than hearing loss, I'm sure too, just with your blood supply. But the one I saw in clinic, that's what it looked like. And the patient did have more hearing loss post-op than pre-op. So symptoms that are typical for a glomus tumor are the heartbeat in your ears, hearing loss, voice changes, problems with swallowing. And there's two different types of glomus tumors. So there's the glomus tympanicum, so that's in the middle ear, or glomus jugulare, which is near the jugular bulb. And that's what I have heard more about. I believe the patient that I saw had a jugular bulb glomus tumor, but they can also happen in the neck and in the carotid arteries. So it's not an ear-specific pathology, but that's obviously where we've heard of them happening. So to diagnose something like this, they are going to do different like blood tests where they can, track your blood supply and everything to see what's happening. They can also do MRIs or CT scans to pick that up. And then treatments, there's non-surgical, so kind of watch and wait. Like we said, they're slow growing. Maybe the patient's not really having any symptoms other than hearing that and, wanting to get it checked out. So there can also be radiation. And then there's surgery too. So remove the tumor, with surgery, but it can affect what's going on around it. And all those nerves are so close there together that, something else can be damaged in the process. Let's see. If the tumor is large, you might need to do an endovascular procedure a few days before surgery to embolize, which is interesting, to cut off the blood supply to the tumor so that when it goes to be removed, you don't have that, active blood supply or bleeding risk. So that's kind of the big overview. They're very rare. So I also wanted to say, if we started the show and you're like, oh no, sometimes I hear my heartbeat in my ears. I have to say that if you put in earplugs or you plug your fingers with your ears, you're going to hear your heartbeat more than you did before you did that. And that's called the occlusion effect. And that doesn't mean that there's anything wrong with you. It's just you're closing off the outside, so you're hearing your own head noise louder. This is like somebody who their ears are not plugged up and they are hearing their heartbeat pretty loud on one side. So it's different than when you've, got your head plugged. That's more like the occlusion effect. So don't panic if you think that relates to you. This would be a very rare situation, and also not while your ears are plugged that you're hearing your heartbeat.
Yeah, I'm glad you said that too, because we're talking about like worst case scenario, but things that we have seen in the clinic as well. But it's not an end all be all either. It could be a lot of different things too. So obviously go into an audiologist or an ear, nose, and throat physician and get diagnosed correctly, and don't self-diagnose just by what you're hearing here or on anything that you see online as well. So I'm glad you said that.
Well, and how many times have you had a patient that had normal hearing get in the booth and we put the headphones on and we shut the door and they're in there and it's all quiet and they're like, I hear my breathing and my heartbeat really loud. Yeah. And I usually say that's a normal hearing problem to have because, if you have significant hearing loss, you don't hear yourself breathe.
Right.
But I could see someone panicking like, oh, I've heard my heartbeat before when I, have my head like laid down or whatever.
Yeah.
So.
Yeah. All right. And then our second question here is, why is my tinnitus like the beat of my heart? So this is something that's a little bit different, and I'll have Whitney talk about this as well.
Yeah. So when this happens, we call that pulsatile tinnitus, which is a good name. It's pulsing like your heartbeat. It can affect 3 to 5 million Americans. So that's quite a few people. So compared to maybe other tinnitus, where it might be like a constant tone, or maybe a tone that comes in or goes out, or has like a bell or a whistle quality, this is again going to follow the rate of your heartbeat. It can have like a whooshing or swooshing sound quality to it, but there's not an external source. So again, it's different from like kind of how I mentioned earlier. If I go on a run and I exert myself or do something, typically I can hear my heartbeat in my ears. It's because I have an elevated heartbeat. This is more for a person who, if you're just sitting relaxing and you're like, I can hear my heartbeat. That's kind of like a pulsatile tinnitus. It is common. So sorry. Nearly 60% of patients who do experience this also suffer from depression or anxiety. So it is higher than those associated with other chronic conditions due to large part and the difficulty in diagnosing it. So a lot of physicians, if you tell them, I have ringing in my ears and it matches their heartbeat, they might not know some of the next steps to go look at, when they hear a patient report that. So, definitely bringing it up to an audiologist or an ear, nose, and throat physician can be a good idea, just because typically if we do have a pulsatile tinnitus, we do want to see if there's an extenuating factor going on behind as to why you're having that. Because again, it can actually be something going on in your body, and that's why. So if it feels like it's following your heart rate, like it changes in pace, like it gets faster when you're working out, or if you're sitting and you find it's slowing down, that can be an indicator that you do have pulsatile tinnitus. So
awesome. All right. So causes, again, just to preface this, like Dr. Galloway said, this is not all the causes, but some causes, right, that are a little more serious. There's a lot of different possible origins. Some might be benign, but some might actually be a little bit more life-threatening. So that's why we just kind of want to talk about it. It can be due to vascular malformations. Hypertension is something that needs to get checked out. Abnormal cerebral pressure, unique blood flow patterns near the ear, and maybe even sometimes a tumor as well. And so we see pulsatile tinnitus also with sinus stenosis, as well as an arteriovenous fistula, or fistula means like a hole, right? So again, lots of different possible causes that needs to get checked out medically. But if there is no underlying condition that is like you've been completely checked out and you have this pulsatile tinnitus, then we can still do some types of therapy that might help. And sometimes it can be sound therapy. It can be noise suppressing devices. So very similar to what we do for tinnitus that is, like Whitney had said, kind of that constant tone. And then also some lifestyle and behavioral modifications can help. So a lot of the times with our tinnitus patients here, cognitive behavioral therapy helps, meditation, or even relaxation techniques. And so sometimes I pair what I do with sound therapy with a clinical psychologist that can help with the cognitive behavioral therapy and the meditation and the relaxation and just coping mechanisms as well. And so again, if medical intervention or treatment or cause is ruled out, then there is still something that can be done. So I want to make sure that that's clear, because a lot of the times people that say, oh, I've got pulsatile tinnitus, so you can't help me, is not necessarily true. But what we do want to make sure that you understand with today's show too is, like we said in the beginning, the main point, if you walk away with anything at all, is if you hear a pulsing sound or a heartbeat in your ear, we definitely recommend that you consult with a physician. I mean, yes, we can help, and we can definitely rule out by doing some diagnostic tests and help with that medical evaluation and send it on to your physician. But definitely we recommend that you follow up with the physician if you have that heartbeat in your ear, and not just from closing off your ears, like Dr. Galloway said.
Yeah.
All right. Okay. Well, with that, we will be back in March now with some new episodes. So thanks for tuning in, you guys, and we'll see you then.
Thank you.